Hi, my name is Ebenezer. Today I will wanna tell you about coronavirus. Coronavirus or severe acute respiratory syndrome coronavirus 2 is a virus that take the respiratory system. This is disease caused by a viral infection is called COVID-19. Coronavirus can cause mild disturbance to the respiratory system, severe lung infection to die. Severe acute respiratory syndrome coronavirus 2, better known as the coronavirus, is a new type of coronavirus that is transmitted to humans, although more attacking the elderly. This virus can actually affect anyone ranging from infants, children to adults, including pregnant women and nursing mothers. Coronavirus infection called COVID-19 and was first discovered in the city of Wuhan, China at the end of December 2019. The virus is transmitted very quickly and has spread to almost all countries, including Indonesia, in just a few months. This makes some countries implement policies to impose lockdown in order to prevent the spread of coronavirus. In Indonesia itself, a large-scale social restriction policy was put in place to suppress and the spread of this virus. In addition to the SARS-CoV-2 virus or coronavirus, the viruses included in this group are the viruses that cause severe acute respiratory syndrome and the virus that cause Middle East respiratory syndrome, although caused by a virus from the same group, namely coronavirus. COVID-19 has some difference with SARS and MERS, among others in terms of the speed of the spread and severity of symptoms. Symptoms of coronavirus. Early symptoms of coronavirus infection are COVID can remember flu symptoms, namely fever, runny nose, dry cough, sore throat, and head itchy. After the symptoms can disappear and heal or even aggravate. Patients with severe symptoms can experience high fever, cold with burn and even bleeding, shortness of breath, and chest pain. These symptoms appear when the body reacts against the coronavirus. In general, there are three general symptoms that can indicate someone is infected with the coronavirus, namely fever, cold, hard to breathe. The symptoms of COVID-19 generally appear within 2 days to 2 weeks after the patient is exposed to the coronavirus. When to see a doctor? Immediately do independent isolation if you experience some symptoms of coronavirus infection, as mentioned above, especially if in the last 2 weeks you are in the area that has case of COVID-19 or contact with sufferers of COVID-19. After that, contact the COVID-19 hotline at 119 X9 for further guidance. If you might be exposed to the coronavirus but don't experience any symptom, you don't need to go to the hospital. Just stay at home for 14 days and limit contact with others. If symptoms appear, then do isolation independently and ask your doctor by telephone or application about what action you need to take and what medication you need to take. If you need a direct examination by a doctor, do not go directly to the hospital because that will increase your risk of contracting or transmitting the coronavirus to others. You can make a doctor's appointment at the hospital through the call center so that you can be directed to the nearest doctor who can help you. Case of coronavirus. Coronavirus infection or COVID-19 is caused coronavirus, which is a group of viruses that infect the respiratory system. In most cases, coronavirus only causes mild to moderate respiratory infection, such as flu. However, this virus can also cause severe respiratory infections, such as pneumonia, Middle East respiratory syndrome, and severe acute respiratory syndrome. It is suspected that the coronavirus was initially transmitted from animal to human. However, it was later discovered that the coronavirus was also transmitted from human to human. A person can get COVID-19 through a variety of ways, namely accidentally inhaling saliva, saliva, or droplet that come out when people with COVID-19 cough or sneeze, hold the mouth or nose without washing hands first after touching an object affected by saliva's place of a COVID-19 sufferer. Close contact with sufferer COVID-19. Coronavirus can infect anyone, but the effect will be more dangerous or even fatal if you occur in elderly people, pregnant women, people who have certain diseases, smokers, or people whose immune system are weak. For example, cancer patients, because it is easily transmitted. The coronavirus is also at high risk infection medical staff treating patients with COVID-19. Therefore, medical personnel and people who have contact with COVID-19 patients need to use personal protective equipment. Coronavirus diagnosis. To determine whether the patient is infected with the coronavirus, the doctor will ask about the symptoms experienced by the patient and whether the patient has just traveled or lived in an area that has a case of coronavirus infection before symptoms appear. The doctor will also ask if the patient has any contact with someone who is suffering or is suspected of COVID-19. To confirm the diagnosis of COVID-19, the doctor will carry out the following tests: rapid test as a filter, swab test or PCR test to detect coronavirus in sputum, CT scan or chest X-ray to detect infiltrator or fluid in the lungs. Coronavirus treatment. Coronavirus COVID-19 can be treated, but there are some steps that doctor can take to reduce symptoms and prevent the spread of the virus. Namely, referring patients with severe COVID-19 to undergo treatment and quarantine in a referral hospital, provide fever and pain reliever that are safe and in accordance with the patient's condition, encourage sufferers of COVID-19 to do independent isolation and adequate rest, encourage sufferers of COVID-19 to drink a lot of water to maintain body fluid level. So this is about coronavirus. That's my story and my presentation about coronavirus. Thank you.